Hi everyone, it's Lisa. I just wanted to go over Chapter 19, Nutrition for Diabetes. Just a couple of things. This week I'm going to have two videos. I'm going to go over some of the highlights of this week's PowerPoint, and then I'm also going to post another video just about some highlights for the case study that you should be aware of. And I'll be making mention of the case study as we go through this chapter as well. This is on your news for the week, but this week, the material for this week will be open for 2 weeks to accommodate both Larimer County and Westminster spring break schedules. They're on different schedules. I will be taking spring break the same as Westminster, which is not this week, but next week. So this week, I just want to show you, there's the PowerPoint for this week, and then under the content section, there are a whole bunch of documents on carb counting. This is really the cornerstone of, here I'll show you, it's really the cornerstone for diabetes management. In the book, they really go into all these different ways to, as far as dietary intervention with diabetes. Carb counting is the only thing I have used. The exchange list is old, it's outdated, it's complicated. Carb counting may seem a little bit more complicated in the beginning, but actually it's fairly easy. It might not be for someone who's actually following that diet, but I think in the beginning it's much easier than exchange list. So just so you see, there's lectures, and then this carb counting info, if you double click it, there are all these different documents, and these will definitely help you with the case study. Particularly basic carb counting information, I would look over this document, absolutely. It gives you really the basics. It's going to help you really answer the questions for the case study. So the following steps are used to implement basic carb counting, and this is what you'll need for the case study. Carb content of food. One of these servings equals about 15 grams of carbs. If you look down here, these are considered non-carb foods, mostly fatty foods, and you can look here, meats, things like that. For some reason, I really would use this. This is what I have used in clinical practice. I really like this list and these documents much better than what I see in the book, and that's why I posted them there. So, just some basics. I have posted this cascade of events as far as blood glucose regulation because I think it makes it very clear, and I would say it's very important to understand normal blood glucose regulation. Here, this just shows, if somebody has elevated, this isn't a healthy individual, okay? This is not somebody who has diabetes. This is what happens basically when a healthy individual has high blood glucose after eating. The pancreas secretes insulin, etc., etc. The glucose enters the cell as it should. Glucose is converted into glycogen in the liver as it should, and that makes blood glucose levels start to come down to normal levels. And then you can see the pancreas, when low blood glucose levels happen, then the pancreas secretes the opposite of insulin, which is glucagon. And then a couple of other things happen to raise up blood sugar levels. So this might happen over here, in the middle of the night after someone hasn't eaten for hours. And so blood glucose levels dip. I would definitely know and understand this cascade of events, okay? Basic facts about blood glucose and the impact of carbs. This is important. The amount of carbohydrate consumed is going to be the #1 factor when you are working with someone with diabetes. The amount of carbs consumed in one meal is going to have the biggest influence on blood glucose levels. And here it says, to a lesser extent, the type of carb eaten. So it used to be that we said, all carbs are created equal. We used to say to people who have diabetes, no sugar, no dessert, minimal fruit. Well, these things are true only to a certain extent. The amount of carbohydrate is going to be the #1 determinant, and then the type eaten is #2. So I don't know if this is the best message to give someone who has diabetes, but you know, whether they're eating 15 grams of carbs coming from fruit or 15 grams of carbs coming from a soda, pretty much it's going to have the same impact on blood glucose levels. Now, of course, we're going to recommend the healthier foods, but it is important to note that it is primarily the carbohydrate load. And then second to that, you're going to want to really focus on promoting those healthy carbohydrates, okay? We really focus on type 2 because 90% of the people you'll be seeing are going to be people with type 2 diabetes. Here are some of the major differences between type 1 and type 2. Here are the risk factors for type 2. You are going to want to look over this very carefully for the case study. This slide and then this slide. These are the only risk factors. When you look at the case study, make sure to only list things that are written down on the case study. A lot of times students will pull out things that they think might be that they think may be a habit of the patient on the case study, but unless it's written black and white on the case study, don't assume anything. So have the case study in front of you and look at these two slides for risk factors, okay? These are risk factors that would increase someone's chances of acquiring type 2 diabetes, okay? Management. The primary management for type 2 diabetes is going to be maintaining blood glucose levels as close to normal as possible. This is the #1 goal. On the next slide, there are secondary goals. The secondary goal is going to be maintaining blood lipid levels and blood pressure, mainly because people with type 2 diabetes have a much higher risk of cardiovascular disease. Okay, so first it's blood glucose levels, and then it's going to be maintaining lipid levels. And then, of course, all of these other things. One of the cornerstones for diabetes management is going to be weight loss. And I'm not going to really get into that too much here, but like it says, there really is no one way for weight loss, but it really needs to be part of the plan, okay? And I've given you I reiterated this slide. You've seen this before when we did weight management. This is just showing how many what kind of calorie deficit somebody would have to be in to lose a pound in 7 days, okay? So you're going to need to look at this to figure out what calorie level your patient should be on for the case study. You need to look at this equation and figure it out, okay? Some things about carbs. Normal, healthy individuals, the range is 45 to 65% of calories coming from carbs. I have never seen anyone with type 2 diabetes be recommended to go over 45 to 50% max. So for type 2 diabetes, it is inappropriate to recommend up to 65%. Remember that for your case study, okay? I would not be going over 50%, 45. I've even seen a little bit less, but very unusual, okay? Carbs have the biggest impact on glucose. I would definitely look at these when we talk, in the question about what are the main points for carbs in terms of lessons for a patient. These are going to be the biggest take-home messages here on this slide. This is just talking a little bit about alternate sweeteners. You know, sugar alcohols, they do provide fewer calories. They cause a smaller increase in glucose, but they very much can cause GI distress. Here are some other dietary considerations. Now this fat, I would pay attention to. There's a question about fat on the case study. You're going to want to look at this. And then they talk a little bit about some of the other options for transforming recommendations into meals, but the main one is carb counting. Not going to go into it so much. I would really read through the documents that are online, not in the PowerPoint, in addition to the PowerPoint. Okay? So this is an example of how to figure out carbs. You're also going to find this in the supplemental information, the handouts that are online for carb counting. But this is going to give you an example for a 2,000 calorie diet if someone's staying on 45 to 50% of their carbs for the day. This is how you would figure out how many grams of carbs that person needs and then how many choices Okay, how many carb choices? You need to figure this out to get to those choices. This is this is going to sum it all up right here. Okay. Glycemic index, glycemic load to a lesser extent is important. I would read up about this. Just understand that different foods have different impacts on blood glucose, and this may be used to kind of fine tune somebody's meal planning. I would not really get into it too much in the first session with somebody. It's too overwhelming, and this is really more for a little bit later down the road when someone needs to be fine tuned. Okay, this is an example of low GI foods compared to high GI foods. Medication, you guys are going to be getting that in a separate class, so I don't really focus on it too much in this class, if at all, because you're going to be getting just medications, oral and insulin, a special class for that as a nurse. Complications, here's some treatment options for hypo and hyperglycemia, and then just some other factors that you should know. And behavior change. So, it sounds really easy going through all these carb counting, all that stuff. It's very, very hard to change behaviors. And these are some really good, especially for the case study that you're going to be doing. Think about this as a real person sitting in front of you. Try to figure out what they are most willing to change first and work with them from there. It's a very steep learning curve with diabetes. So, all right, you guys, I'm going to end it there, and I'm actually going to start another one. I'm going to post a separate one just for the case study with some just pointers there. So good luck and have a great week.